Hi everyone, welcome to today's webinar on unveiling the freeze response in sexual assault tonic immobility. So before we begin, please note that this webinar is intended solely for research purposes. So for any personal experiences or legal concerns related to sexual assault, we encourage you to seek professional support. This webinar will cover sensitive topics like sexual assault. So if you feel uncomfortable at any time, please feel free to exit. Thank you so much for your understanding. So a bit of a self-introduction. My name is La-Mia, and I'm a final year psychology undergraduate at NTU. I'm currently working on my thesis supervised by Dr. Majeed, which explores individuals' perceptions on sexual assault survivors. So looking ahead, I aspire to build a career in forensic psychology, focusing on both practice and research. So now it brings me great honor to introduce Dr. Majeed, who has collaborated with me to share with you our research findings on freeze today.
Hi, can you hear me clearly?
Yep.
Yeah, thanks, Lamia, for that. Hello, everyone, and welcome to our webinar. So I'm Majid, and I teach forensic and criminal psychology at the Nanyang Technological University as an associate professor, adjunct associate professor. I also work as a psychologist at the Ministry of Home Affairs. And so one of my passions is actually developing the research base in the area of criminal and forensic psychology. And this particular webinar that Lamia and I are doing is going to be part of a series of seminars that we will run in the area of criminal and forensic psychology. Yeah.
So in this webinar, our goal is to increase awareness about the freeze response, which is a common yet misunderstood reaction some survivors of sexual trauma have experienced. So briefly, today's presentation will cover Dr. Majid's case example and a psycholegal perspective on freeze, followed by neurobiological mechanisms and the implications of trauma, and recommendations for how professionals can best support victims. So before we get into the details, let's briefly look at a few foundational studies on tonic immobility or the freeze response in trauma. So these studies have shaped our understanding of involuntary reaction in high-stress situations. The first study is by Marks and colleagues, which focuses on tonic immobility, which I'll now refer to as TI, in sexual assault survivors, identifying fear and physical restraint as primary triggers for this response. Next, Dr. James Hopper explains why many survivors may freeze and not fight back during an attack, offering a neurobiological perspective, challenging the misconceptions about trauma responses. Galliano and colleagues adds to this by exploring freeze, linking immobility with specific post-trauma symptoms. And Dr. McDermott, which writes for Psychology Today, addresses why women often freeze during assault, underscoring that it is an automatic and beyond conscious control response. Finally, we have Gallup's study on freeze, which looks at how it's moving across species, understanding how it's working through biology, and suggesting that it's a deeply ingrained survival mechanism. So with this foundation on the freeze response, I'll now hand it over to Dr. Majeed to discuss the psycholegal perspectives.
Thank you. So let me just say a few words about some of the key concepts here. One of the concepts is this idea of tonic, right? So, and you may be wondering what you mean by tonic. So, tonic really refers to a sustained muscular contraction or rigidity. So we're finding that people will find it hard to move, and sometimes this could also be about a mental state as well, like a freeze in the mental state. So that word tonic actually comes from the Latin word tonos, which is really tension. And this whole concept is something that is worth further research and deeper understanding. Because typically in stress studies, right, people always talk about the fight or flight syndrome, right? And in more recent times, although there has been talk about freezing, I think we haven't fully appreciated what that actually means as far as a trauma response is concerned. So why do people freeze at all? It's useful to understand this before we jump into some of the legal cases. And one of the reasons experts have talked about this tonic immobility is because of they argue that it's an evolved survival mechanism, right? Uh, so when you think about it, you might wonder, how is this a survival mechanism if you don't move, right? And a lot of these early studies have come out from animal research that actually says that the moment a prey moves, right, then it easily becomes noticeable, right? And so it starts with animal behaviors. So the more you move, the more noticed you are, and well, basically you can't survive. And that kind of research has now evolved on to more human behavior, human stress, human trauma kind of research. And although some of it has started off with sex crimes victims, now they're beginning to look at also children as well. But let me jump into some of this psycho-legal issues, starting with this case that happened in 2015. And this was a case involving the accused person, Chang Kam Ming. So this was Chang Kam Ming versus PP, public prosecutor. And this was a court of appeal case. But the facts of this case was that this perpetrator saw this young Myanmarese lady who was married to a Singaporean come back late at night. And so he followed her, then hit her at the back of her neck, and she fell on the ground. And he then stole her purse, the wallet, about $2,000 worth of cash, and then lifted her bra and her clothes and took photographs of her naked. So while originally she was unconscious, later on she did regain consciousness, but she pretended, according to the media and the newspaper, she pretended to still have fainted. Uh, well, to cut the long story short, right, the accused was then jailed for 17 years. It was a sentence laid out to him. And he actually carried her to the flat at some point of time. And while he carried her, she pretended to be unconscious. At least this was reported by the media that way. And you must remember it's in 2015 where there wasn't that much awareness about the concept of tonic immobility. So as La-Mia and myself researched this and we studied this, one of the things we were thinking about is, could it have been that, perhaps she faced TI, right? Tonic immobility. Was that a possibility, as opposed to, her coming in and out of consciousness? So that was one of the significant cases that illustrated this whole concept of TI. Moving on to the next slide, Lamia. The other case of interest is PP versus Tan Chi Beng and another appeal. And this was a particular case that involved a superior, a boss of a company who committed 4 acts of sexual molestation on his subordinate. So there were 4 acts that were committed. And this particular judgment was issued by Honorable Justice Vincent Hung. And next slide, please. So the lower courts, in the lower courts, the district judge, if you can read the first sentence there, the district judge actually found that the victim's failure to scream during any of the incidents actually affected her credibility. So the lower courts judge actually felt that she should have screamed. She should have put up a fight. If she didn't, well, then her credibility is affected, right? And he explained in the next sentence that there was no explanation given as to why the complainant did not scream for help. Moreover, as a mature adult, there's no reason for her not to shout for help. So there was an expectation legally that if somebody is victimized sexually, they should actually fight or scream or yell or kick up a fuss. But the higher courts, thankfully, actually looked into the literature, and you can see the highlighted part of tonic immobility, and argued in the paragraph that, and I quote here, it was simply not a question of whether the complainant was a mature adult or not, right? The fact of the matter is that victims of sexual assault, regardless of age, maturity, or even gender, cannot be expected to react in a uniform way. And 2 or 3 lines above that, there's a comment that a substantial number of victims may experience tonic immobility. So it's amazing and very wonderful to see how the courts have been very aware of some of this psychological literature, even though this is emerging literature. And there's still a lot of discussion as to how we interpret the concept of tonic immobility in legal and criminal justice systems, because it's not one size fits all, right? Not everybody freezes. Um, so and later on, La-Mia and I will make the point at the end. Is it the case that if you don't freeze, then you could have fought? Is that an assumption? Which may not be the right assumption also. So, but because this is research, right, we are presenting these ideas for discussion and for thought, and we're not presenting it in a definite way. Next slide, please. In another case of public prosecutor versus GCK, and this was also at the Court of Appeal by the Honorable Chief Justice Sundaresh Menon. Here in paragraph 111, in this particular case, there was another commentary. But this case was a case of a worker who molested an elderly lady who was a bed-bound resident at a nursing home. So he was sexually assaulting her, and there was a witness who saw this. And so this case, from a legal perspective, led to a discussion as to whose account is more credible. Is it the account of the victim, or is it the account of a witness? And the early thinking as this case proceeded was that witnesses can't be more credible than the victim, because witnesses are far away, there's some distance, and therefore their account may not be as reliable as the victim. But as the higher courts have discussed in paragraph 111, you can see that the courts are also of the opinion that even though the victim may have an account of what actually transpired, if the victim actually faced severe amount or very high levels of trauma and had a very strong traumatic reaction, it is possible that they may have faced some degree of tonic immobility, which might also affect the way they think about things, their memories, and their entire physical reaction. So this was also another case that we had discovered as we did our research on TI and looked at the application at the criminal justice system.
Thank you. So I'll now be taking you all through the neurobiological mechanisms of the freeze response and how the brain responds to threats. So when we encounter a threat or a dangerous situation, we are programmed with the survival instincts of active fight or flight reactions, which happen automatically. And these responses have been adapted through evolution, thought to be by our ancestors who would react to life-threatening situations. So when we encounter a threat, we will first freeze, even if just for a split second, to rapidly assess the situation. So in the brain, the amygdala detects the danger and then sends a distress signal to the hypothalamus. So here, the hypothalamus will communicate with the body's autonomic nervous system to initiate the release of adrenaline and prepare the body and the muscles for action. And the prefrontal cortex, which is involved in rational thinking and decision-making, instincts will take precedence over immediate threats, and it can help to process the threat if the time allows, helping the individual choose the most effective response. So the hypothalamus activates the autonomic nervous system, where the sympathetic branch will kick in to prepare the body for fight or flight. So this will involve a range of physiological changes like having a faster heartbeat, increased blood flow to the muscles, and heightened alertness, which is all aimed at quickly mobilizing the body for action. And once this threat is gone, the parasympathetic system will activate to calm the body and slow the heart rate down to restore balance. So this diagram here is by a study, which illustrates how fear escalates with proximity to a threat, so leading to different defensive behaviors like freezing and fight and escape. So it highlights the progression throughout all of these different behaviors and ultimately to tonic immobility if all the other responses fail. So the moderators, like having prior exposure to trauma, indicates a factor that can influence an individual's response to a threat. So as a society, we've grown accustomed to the fight or flight response being the major two responses to trauma, but what about those who freeze instead? So when we encounter a threat, the body sometimes freezes instead of immediately fighting or fleeing. This momentary pause, which I mentioned earlier, can help us to assess the danger before we commit to a plan of action. So if the threat feels overwhelming, however, the parasympathetic system can take over more strongly. So this shift will lead to a state known as TI, which is a more intense and prolonged form of freezing, where the person is temporarily just unable to move or act. And research has shown that many sexual assault survivors experience TI as a natural defense mechanism. So let's explore the distinction between freezing and tonic immobility, which are two responses the body can take when faced with a threat. So freezing is a temporary pause in response to a potential danger, so as it allows us to assess the situation and keep our options open for what to do next. So it's like a quick standby mode for the body where we're holding back from immediate action, but we're ready to move if necessary. Tonic immobility, however, is quite different. It will kick in under very extreme fear or when there seems to be no way out. So unlike the flexible free state, it's a full body shutdown process and the last resort defense mechanism. And research has shown that many sexual assault survivors might experience tonic immobility as a natural defense mechanism. And this understanding of tonic immobility is crucial for especially trauma recovery because it underscores the inability to act is a biologically rooted survival response. So studies about tonic immobility in humans is now emerging, and it's believed to occur during sexual assault. And interestingly, there have been reports of this fear-free state in also air disasters and naval disasters. And I'll now go more in depth to illustrate tonic immobility. So it's a deeply ingrained survival response thought to have evolved as a defense in a very life-threatening situations. So in extreme cases like sexual assault, it can manifest as also what's sometimes called rape-induced paralysis, where the individual is physically unable to move or resist. So it's typically triggered by overwhelming fear, especially when escape is impossible. Interestingly, this response may also be a first-line reaction for individuals with past trauma or specific personality traits. So some of the characteristics of TI includes physical immobility, the inability to speak, dissociation, sensations of coldness and numbness, periods of eye closure, and also a slower heart rate. So interestingly, despite being immobilized, the victims remain conscious and fully aware of what's happening. So the research indicates that it doesn't affect memory or their consciousness, and individuals are often highly alert to their surroundings throughout the trauma. This study by Khader and Duma in 2021 was conducted in South Africa, and I'd like to bring your attention to it because it provides very powerful real-life insights. So 14 Nigerian women courageously shared their experiences of DI during or after a sexual assault, detailing both the intense physical immobilization and the mental paralysis which they experienced. So here are some of their quotes. So one victim shared that I could not process what he was saying or doing to me, neither shout nor scream for help. I just became like a log of wood. It felt like I was paralyzed all over my body. And we can see physiological reactions here by I was panting, my heartbeat was racing very fast, and my legs were numb and heavy. So when someone faces an unexpected attack, the brain's defense circuit, which is responsible for these automatic responses, will take over. So initially, they have the brief freeze as they assess the threat. And if this state will extend, it can transition into tonic immobility, where the brain essentially just stops generating escape options. So some of these key mechanisms include, like previously shared, the amygdala, which normally sends the distress signal, may actually shut down and reduce the urgency and limit the active responses. A lack of sympathetic arousal will also occur as the parasympathetic system, which is in charge of relaxing the body, will dominate. So this keeps the heart rate steady and the skin cool, which signals a passive state. Parasympathetic activation, so the other branch of the nervous system, can also slow the heart, creating numbness and detachment during the experience. And this nervous system branch also links to the brain's default mode network, which reduces engagement with the outside world and might also explain why some victims experience dissociation. So we have the dorsal vagal complex, which activates and reduces energy, which causes the muscles to collapse into immobility. So the feeling like they cannot move. Then we have the high stress chemicals, which impair the brain, which is in the impaired prefrontal cortex. So impairments may leave victims fixated on single thoughts like, please help me. So we also have the periodactyl gray in the midbrain, which releases opioids, which dull pain and help the individuals endure the trauma. So as we can see from all of these interconnected mechanisms, tonic immobility is a very complex involuntary shutdown process of the body, and it is not a conscious choice. As Dr. Jim Hopper puts it, none of these responses by women or men implies consent or cowardice, and it reflects how fear can dominate our brain and our body. So, TI is more common and intense in survivors of sexual violence, particularly those with a history of past trauma. So, women who have experienced childhood or adult sexual abuse might be more likely to experience this response. So, TI often leaves survivors with deep feelings of shame, self blame, and psychological distress. So, a follow up study by the same researchers, Khader and Duma, in 2024, more recently, deepens our understanding of the mental health toll that TI has on survivors. So, in addition to the immediate impact, this study revealed how survivors interpret their experience through a lot of self blame, feelings of failure, and at times even suicidal thoughts. So, for some survivors, TI leads to a lot of self loathing and thoughts that they allowed the assault to happen, which really hinders their trauma recovery. So societal expectations of actively resisting often amplifies this self-blame. So cultural beliefs about real victims who fight back creates a very harmful narrative, causing many survivors to feel a lot of guilt and failure for their body. So negative attitudes from law enforcement and healthcare providers might intensify this trauma, contributing to what we call the shadow of tonic immobility, which is a lingering sense of guilt and a fear that tonic immobility will happen again to them. So, building on these findings, TI often leads to intense self loathing as survivors feel that they fail to protect themselves. So, without an understanding of TI as an automatic response, survivors might harbor a lot of anger, shame, or even feel that they allowed the assault to happen to them. Gahaba and Dumas' 2024 study highlighted that some survivors who experience TI often report suicidal thoughts due to the weight of self blame. This brings the importance of healthcare providers to assess survivors for TI potentially, for suicidal ideation, and also helping them to ensure they have psychological support. So, building on recent research, these studies provide key insights into how tonic immobility affects trauma survivors both psychologically and physiologically. So, a 2023 review by Coimbra and colleagues links tonic immobility to a higher risk of PTSD. Most recently, Rubin and Bell found that tonic immobility during assaults intensifies memory, further connecting TI to lasting trauma effects. And lastly, in 2019, Quilling and colleagues demonstrates that it heightens the likelihood of having intrusive memories like flashbacks, emphasizing the role in trauma recall. So together, all of these studies and findings underscore tonic immobility's impact on immediate and long-term trauma responses. So now I'll be going through some of the mental health implications and the increased risk of PTSD, anxiety, and depression. So TI has significant mental health implications. Emotionally, survivors often experience anxiety, depression, fear of future immobility, leading to a lot of feelings of weakness and self-doubt. These emotional responses can hinder recovery, and TI is also being known to disrupt memory encoding, creating very vivid, sensory-rich trauma memories that are very difficult to manage. This also contributes to PTSD, even if dissociation occurs. And as a result, survivors are nearly 3 times more likely to develop PTSD, with a lot of self-blame and this feeling of lost control really complicating their healing process. So how can we address TI in sexual assault cases? So TI is a common trauma response, but it can be misunderstood. A Swedish study of 298 women who visited an emergency clinic within 1 month of their rape found that 70% of women experienced TI during the assault, which really amplifies the need to recognize TI in survivors' interactions with healthcare and justice systems. However, a caveat of this data is that it was self-reported, and the limitation of this underscores the need for a lot of more robust research in this area. So behavioral manifestations following a victim's experience of TI can often confound first responders, health professionals, and law enforcement. Many professionals struggle to understand how survivors can vividly recall the traumatic details, but they are unable to resist during the assault. And this lack of understanding creates a barrier to effective support for survivors, and educating society on TI as a natural response to trauma is essential to addressing the gaps in knowledge, ensuring that survivors are validated and supported. So I'll now suggest some trauma-informed recommendations for legal professionals and law enforcement to adopt. And it's important to note, however, that there has been ongoing discussions about how we can incorporate trauma-informed practices about freezing into legal reform. And this has been ongoing for some time, but it's important to acknowledge that further research is needed to refine their understanding. So in the legal system, a key area that we might explore is evaluating the value and the applicability of adopting an affirmative consent model within the Singaporean context. So currently, only a small minority of states in the US, as well as Australia and Canada, have implemented the affirmative consent laws, also known as the Yes Means Yes standard. So it's defined as a knowing, voluntary, mutual agreement among all participants engaged in sexual activity, and it's moving beyond outdated notions that silence, lack of protest, or resistance is equal to consent, and it aligns with our understanding of responses like tonic immobility. And this model aims to remove ambiguity around consent, and it also helps to reflect our growing awareness of trauma-related behavior. So minimizing victim trauma during sexual assault cases requires a commitment to trauma-informed approaches within the criminal justice system. So first, police officers and legal professionals might unconsciously perpetuate rape myths, like the belief that real rape is committed by strangers. And it's very important for professionals to be educated on these misconceptions, as it might undermine the fairness in the investigation or trial process, and also risk increasing the trauma for survivors. Secondly, recognizing the counterintuitive victim behaviors is essential. So survivors might delay their reporting. They might also remain in contact with their offender or freeze during the assault due to TI. And that's why expert witness testimony can be very invaluable in explaining these trauma behaviors, ensuring that both the police investigation and courtroom proceedings are trauma informed. Finally, training on implicit bias is quite crucial. So for police, this means avoiding skepticism about victims that might appear calm or disconnected. And for legal professionals, it involves understanding TI as an involuntary survival response, which explains the inability to resist. So these trauma-informed practices ensures that survivors are treated with empathy and fairness. So supporting survivors of sexual assault requires these trauma-informed approaches and also collaboration with mental health professionals to ensure comprehensive care. So implementing practices includes validating the victim's experience, acknowledging TI, and also allowing the victim to disclose their experience at their own pace. Next, integrating mental health expertise into legal and law enforcement practices can also help ensure victims are best supported throughout their journey, where they can offer psychological support during trials or interviews and help them meet their psychological and emotional needs. So I'd like to bring a very interesting article by Professor Flo, which is quite thought-provoking. So she mentions why incorporating tonic immobility into rape law reform might be premature or at least warrants caution. So while reforming rape law and policy might be necessary to improve prosecution rates, tonic immobility does require a lot more empirical evidence. So Professor Flo writes that using tonic immobility as an argument for law reform implies that if victims could fight back, then we might expect them to. But for what other crime do we expect the person being attacked to fight back? So we don't ask a victim of robbery if they fought the robber to determine whether their wallet was stolen, nor do we tell them not to blame themselves as it was an expected biological reaction to not fight back. So applying tonic immobility to courts and laws might risk promoting victim blaming. As Flo states that it implies victims who did not experience tonic immobility that they should have fought back. So this may be concerning for a victim that says that she did not fight back and yet was not frozen in fear. So it's essential to develop a lot more objective methods to measure tonic immobility across different trauma contexts and to also establish whether it can be reliably generalized to humans. So I'll now move on to recommendations for mental health professionals. So, as mental health professionals, adopting trauma-informed care is essential when supporting survivors of sexual assault. Firstly, it's critical to validate and respect survivors' experiences, reassure them that they're not to blame, they're not alone, and they are believed. And to assess for TI using validated tools like the Tonic Immobility Scale, which will ask participants to retrospectively rate their experience features of TI, or the STOP measure, which assesses the presence of TI after trauma. So, recognizing how tonic immobility might influence our emotions, thoughts, and behaviors will help to guide treatment more effectively. So, survivor empowerment starts with education. Many survivors will experience shame or self blame due to TI, and it's important to explain it's an involuntary survival response. So, a key message to present to them is that, your body's response was hardwired to protect you, and you are not to blame. So, utilizing cognitive processing therapy like CBT can further address self blaming thoughts like, I didn't do enough or I can't trust my body. So, highlighting the adaptive role of TI, like reducing physical harm during an assault, can help survivors to reframe their experience. And lastly, self compassion is crucial. Survivors often report low self compassion, so fostering kindness and connection can build resilience and reduce shame. And many survivors fear experiencing tonic immobility again. So, therapeutic interventions could focus on reducing this fear and helping survivors regain a sense of safety and control in their body. So, using grounding techniques are vital, and reassuring survivors with simple messages and using calming strategies can help them reorient. So finally, staff sensitization is key. So training clinicians and emergency staff to provide empathy, reinforce positive messages, and correct self-blame ensures that survivors are receiving compassionate care. So comprehensive education on post-trauma impacts, such as intimacy challenges or sleep issues, can also help them navigate their recovery with greater understanding. So I'd like to go into some research implications now of tonic immobility. So the current research on TI is primarily based on self-reports, animal studies, and related fear responses like dissociation. So in humans, TI is mostly assessed using self-reported measures that reflect the physiological and behavioral symptoms observed in animals. And animal studies, which use threatening stimuli to trigger the defensive response, like TI, has shown increased cortisol in the central nervous system, which is linked to fear and more anxiety. So I'd like to show a quick clip of what TI looks like when an animal experiences extreme fear.
Body with powerful muscles. But when the seal catches the penguin, the intense fear triggers tonic immobility in the penguin, which makes the bird appear lifeless. Because the seal thinks it is dead, it momentarily releases its grip to adjust its position before its feast, and the penguin gets a second chance to escape.
TI can often last seconds, minutes, to even hours as well. So despite these advancements in our knowledge about TI in humans, there is a significant gap in understanding the physiological symptoms of it in humans. So most of the foundational work has been conducted in animals, and objective measures currently remain unclear. So future research should focus on developing objective physiological measures to better assess how TI might manifest in humans and survivors. So this will help to improve the accuracy of our diagnoses, but also deepen our understanding of the neurobiological mechanisms underpinning TI in humans specifically. So now we've come to the conclusion, and understanding TI as a biological reflexive response to extreme fear helps us shift the narrative for sexual assault survivors. So by recognizing that it's a normal reaction, we can help survivors feel safe to disclose their experiences. And as I mentioned previously, future research is essential to equip healthcare providers with the objective tools to identify it, and also to guide legal reform so that courts can understand TI and its effects more accurately. And together, through awareness, research, and reform, we can help to create a more compassionate, informed society that empowers survivors and breaks the cycle of trauma. So as we come to the end of the presentation, here are some resources available if you require support. So I'll leave this on the screen for a couple seconds. Okay, so I'd really like to thank you all for taking the time to attend this webinar. I really hope you found it insightful and were able to take some valuable perspectives and practical knowledge away.